is Desiree Stringer, and I'll be doing my range of motions. Active is when the patient is able to do these range of motions by themselves, and then passive is when the nurses will help the patient with these exercises. You always want to use good body mechanics when you are performing these exercises, so it'll prevent the patient from injury. You want to keep your hands on the joints when they are moving it, depending on which part of the body you're working on, depends on which joint you'll hold. And this will also prevent injury. You never want to move the joint past the range of motion. And you always want to stop if the patient is feeling any pain or fatigue. And you also want to encourage these patients to do these exercises so they don't have tight and stiff muscles and they're able to move freely. And also, when you're moving those joints, it causes warmth in them, which allows them to move more freely. Now I'm going to step back here so you're able to see me when I'm doing these exercises. We're going to start by the neck, and when you're doing the neck, you're going to want to have both hands on the face of the patient, and this allows help with them to move their neck around. And then when you're looking straight ahead, that's extension. Hyperextension is when you're moving that head up, chin up. And then flexion is when you're moving it down. And then you're going to put your ear to your shoulder, and that is lateral flexion. When you're doing these exercises, you're going to want to do them on both sides of the body, so not just one's stronger than the other. And you also have rotation, which is when you look over your shoulder, and this will help that neck move more freely. Then we're going to go to the shoulder. When you're working with the shoulder, you're going to want to hold the shoulder and the elbow, or you want to hold the wrist and the shoulder. And then extension is when it's right beside you. Flexion is your hand in the air, and hyperextension is when it is behind you. I'm going to step out over here so I can show you. Adduction is when you bring that away from your body. Adduction is when you bring your hands into your body. And internal rotation and external rotation. External rotation is when you move your hand up to your elbow level right there. You're going to want to turn it out for external and in for internal. Then we're going to go to the elbow. And with your elbow, you're going to want to hold their elbow and their wrist in these exercises. And extension is with it straight out. And then flexion is with it flexing, like you're flexing your muscles. And then you're going to want to do your forearm. When you're doing your forearm, you're going to want to hold the elbow and the wrist. And then supination is when the palms are up. Pronation is when the palms are down. Then we're going to go to the wrist. When you're doing these exercises, you're going to want to hold the wrist. And then we have extension. Flexion is when you pull it inwards. Hyperextension is when you pull it backwards. And then abduction is away from the body. You want to pull that pinky finger to your forearm. And adduction is when you pull that thumb to your forearm coming inwards. Then we're going to go to your thumbs. And with your thumbs, flexion, you want to put your thumbs to your palm. And then hyperextension, you want to pull it back. And then opposition, you want to touch those fingers all together. And then we're going to move to your fingers. When you curl your fingers in and touch your palm, that's going to be flexion. Extension is when your fingers are out normally. Adduction is when they're spread apart. Abduction is when they're pulled, when they're together. Then you're going to want to go to your hip. When you're working on your hip, you're going to want to hold the knee and the ankle, or you want to hold the hip and the knee. And you can also do this laying down, with the patient laying down, and holding those areas for them. Flexion is when you pull that leg up. Hyperextension is when you pull that leg back. Abduction is when you move it away from your body, and adduction is when you bring it back into the body. And then also we have external rotation and internal rotation. External is away from the body. Pull that thigh and that leg away from the body. Extend those hip muscles. And then internal is when you're bringing it into the body. And then we're going to want to go to the knee. When you're working on the knee, you're going to want to have the hands at the knee joints and the ankle joints. And we have two for those, which is flexion and extension. Then we're going to go to the knee down to the ankles. And when you're working on the ankles, you're going to want to hold the ankle. We have 4 for those. Dorsal flexion is when you have that toe up, and then plantar flexion is when the toes are down and pointed. Inversion is when the foot is in, and everversion is when it's out. Exversion and everversion is when it's out. Then also we have the toes. I'm not going to take my shoes off for this video, but with the toes, when they are curled in, that's flexion, and when they are straight, that's extension. And that's how they normally are. And then also when you get done with these range of motions, before you touch the patient, you're going to want to wash your hands and check their charts and everything. And then afterwards, you're going to want to wash your hands again.